This is the Cato Daily Podcast for Saturday, May 2nd, 2020. I'm Caleb Brown. Many states have suspended regulations that hampered public and private responses to COVID-19, and they did so with remarkable speed. It raises the question, were they needed at all? As states begin to reopen, what regulations should simply be done away with permanently? Matt Mitchell with the Mercatus Center describes a framework for judging regulations that have no business coming back. Regular listeners will have heard lots of discussions here about state-level regulation and how much of that was either suspended, some of it was done away with, some of it was relaxed in the wake of this pandemic. So, what have you seen that you think was notable in this period?
Well, it's pretty extraordinary, both in terms of the scope and the depth of the types of rules and regulations that have been suspended. So, just the breadth. Think about it. Americans for Tax Reform, among many others, have been trying to list and keep up with all the regulations that have been suspended or eased. Their list now is up to 400. And many of these are somewhat minor rules. The USDA has said that they are going to allow some flexibility in terms of when children can be fed during certain from federal programs, school lunch programs, and the like. That's relatively minor. On the other hand, there's some really well-entrenched regulations that have been around for decades that reformers have been trying to push for to ease for quite a long time, and those are being eased. So, for example, 22 states have moved to ease or suspend what are called certificate of need laws in healthcare. So it's amazing. Scope of practice rules at the state level are being suspended. Barriers to telehealth. New Mexico is allowing Canadian nurses to provide care here in the state. So it's pretty amazing the number of regulations and the types of regulations that are being eased right now.
So going forward, when you take stock of how quickly a lot of this stuff was suspended. Of course, President Trump had a Rose Garden presser where he just announced a whole lot of stuff is just going away temporarily at the federal level. The speed with which a lot of this has been done away with, I think, is extremely notable.
Mhm.
So going forward, how should we judge what regulations ought to stay away, and what's the low-hanging fruit of getting rid of some of these regulations entirely?
Mhm. Well, it helps to point out that so many regulations get basically zero scrutiny once they're on the books. So they show up, and there's this regulatory accumulation problem that happens where both the federal and the state governments try to do their due diligence when they formulate new regulations, but they do nothing to evaluate existing rules on the book. And that's problematic, of course, because when you're evaluating a proposed rule, that's exactly the time when you have the least amount of information about how it's going to work. But a rule that's been around for 30 years, that may have been studied by economists and other social scientists, we know a fair amount about how those rules work. So what we propose is set up a system that systematically evaluates, makes use of a lot of this social science research, and also makes use of this experiment that's happening right now in the suspension of these rules to take a retrospective view of these things and say, do we really need these? And in my view, the types of rules that we should be the most suspicious of are those rules that protect special interests from competition or provide them some sort of regulatory privilege, particularly at the expense of the broad public.
So there has been some delegation from FDA to
Mhm.
states. Are states, in your view, interested in maintaining the ability to, say, develop their own diagnostic tests or other issues where the feds would normally govern, but states have taken up governance of some of these issues.
You know, the Madisonian in me says any politician is happy to accumulate some power, although they're usually a little bit reluctant to take responsibility for bad things that happen. So it really is probably going to depend on the temperament of some of these state policymakers. It's interesting to tell that story of how that happened. So the FDA just dropped the ball so significantly, and the CDC as well, of course, with the testing in the United States. And by some estimates, we were behind by at least 6 weeks or more because of those failures. And eventually, as a result of that, the FDA just threw up their hands and they said, okay, we're going to allow the states to handle approval of new tests because we just can't keep up with it. And we obviously screwed up so much. So it'll be interesting. I don't know whether states are going to be jealous of that prerogative and going to try to maintain it or not once the crisis abates a little bit.
In terms of public opinion, when these rules and when people are trying to reinstate them or fight to end the suspension of certain of these regulations, we have this case that is ongoing right now that is a pretty strong case for not bringing a lot of these regulations back. And that people will just say, well, what if there's another global pandemic?
Yeah, that's right. And this goes for rules that uh, are touch people's lives in a very simple, easy way. Take for example the idea that you can get alcohol delivered to your house. Um, Many people are made aware of this now. The idea that you can distillers should be allowed to easily and convert from making hard alcohol to making hand sanitizer. What's really remarkable about this is that in a as people go about their lives in a normal day, they come in contact with all sorts of regulations, but they don't know it. And that's because really for the most part, the way a regulation affects you is it limits uh, it limits you in ways that you don't even appreciate or realize. Nobody knew that they could have alcohol delivered to their house, right? Nobody knew that the nurse practitioner down the street uh, could be able to treat them, and let alone treat them in a telehealth setting without even having to necessarily physically interact with them. But people don't know that. So what's really interesting about this experiment right now is that people are becoming aware of these rules in a way that they never were before. And so I suspect there's going to be a fair amount of public pressure to keep a lot of these rules off the books. Don't bring them back. If they didn't make sense during the pandemic, they're certainly not going to make sense if the pandemic comes back in the fall, and they may not make sense in regular times either.
A lot of the regulations you just talked about, customer facing issues where there is a direct connection where people can actually see the benefits of not having certain regulation on the books, but that doesn't account for a lot of it.
Yeah, that's true. That's where there's real subtle things. So I mentioned earlier certificate of need laws. These are rules that are found in 35 states and the District of Columbia. Most people don't know that they exist. These are rules that say if you're a healthcare provider and you want to open or expand your facility, you want to get a new bed or buy an MRI machine or start offering drug or alcohol abuse treatment, you have to go before a regulator and ask for permission. And in the process of asking for permission, the regulator is not going to be evaluating your safety record or your qualifications. Instead, all they're going to be doing is second guessing your claim that you think that your community could benefit from this service.
And in many cases, in certificate of need specifically, you have to go to the incumbent and ask them if they want to provide this service first. And they have
Yeah,
to
that's
say,
right.
they have to effectively say, no, we don't want to provide this, and yes, we recognize the need.
That's right. They're invited to come before the commission and or regulator and offer reasons for why they would prefer not to have a competitor. Sometimes the board itself is comprised of members that you would be competing against, hospital association members or other providers. So it's really controversial. but and it's been associated with lower quality care, higher cost of care, and less access to care. So it really does affect us as patients. But the vast majority of us had no idea that these exist.
I can see potentially in the future, not to end on a down note here, but I can see a massive new wave of regulation coming in the wake of this pandemic, particularly with respect to restaurants and how they associate with customers. I could see meat processing plants facing a new wave of regulation in terms of how they handle product and how that gets moved to market. Grocery stores, pretty much any place where people congregate, even just loosely associating with one another, standing in the same aisle of a grocery store, for example. Um, is to what extent should we be concerned about that and disallowing these individual private actors to make their own rules?
Well, I do think we should be concerned about that. Your listeners, I'm sure many of them are familiar with the economic historian Bob Higgs, whose thesis in his book *Crisis and Leviathan* is that essentially a crisis is the health of the state. Whenever crises arise, whether it's financial, economic, international conflict. He didn't write about pandemics, but this is certainly fits that. The usual rule, of course, is for the state to grow, and in many dimensions, we're seeing that. There's a lot of new. I think there's something like 8 or 9 new facilities at the Federal Reserve. There's a lot of new fiscal programs being set up at the federal and the state level. And I think you're right. We should anticipate that there's going to be calls for new regulations. What's unique about this is that, unlike other crises, our previous regulations are making it difficult to deal with the current crisis. And so we're actually seeing some relaxation of rules. But this is, of course, alongside the stay-at-home orders issued by most governors. So we it's just a weird time where you have this extraordinary confluence of both regulation and deregulation. But one thing I would note in terms of the relaxation of in terms of the imposition of those new rules, it's sometimes difficult to figure out, attribute our changes in activity to either government or culture. And in my view, a whole lot of the things that we think of as like, federal or state, I guess not federal, but state lockdowns, we were voluntarily doing a lot of that stuff before. The NBA, of course, was the first major organization to cancel its activities, and that sort of snowballed into others. It looked to me around that time that basically a lot of Americans were voluntarily taking a whole lot of sensible actions, some maybe a little bit overreactions, but some pretty sensible actions to essentially self-regulate. And so it would not surprise me if, even without these rules, people continued to stay about 5 or 6 feet away from one another in grocery stores, at least until we get a good vaccine and a little bit more herd immunity. Don't second guess all those voluntary private governance mechanisms.
When we tally up all the regulations that ought to be seriously reconsidered in the wake of a global pandemic, what has Mercatus done?
Well, what we're suggesting is what we call a fresh start initiative, and we're not the only ones who have suggested this. And a number of folks that are smarter than I have suggested something like this. But the basic idea here is don't automatically put these rules back on the books. Come up with a process that systematically evaluates them. And unlike the normal regulatory process where a rule is kept on the books, and if you think about suspending it, the special interests have an outsized ability to block that. Reverse sort of that dynamic and give the general interest a fighting chance here. And so what we suggest is that states and the federal government follow the same kind of principles that have allowed special interest privileges to be taken away or suspended or eliminated in the past. So we suggest following things like the same basic mechanism that was adopted in the Base Realignment and Closing Commission. By the way, you also see this same kind of logic in fast-track trade negotiation and other types of deregulations. But the idea here is allow legislators to cast a conspicuous vote for the general interest, saying we're suspending or eliminating bad rules, but then give them some cover and allow somebody else, expert commission. You can follow what a British Columbia deregulation effort in the early 2000s did, which they had actually an executive level push for deregulation. But you allow somebody else to examine the rules and come up with specific recommendations of which rules should go, and then allow Congress allow those rules suspensions to take effect unless Congress takes some sort of positive action to oppose it.
In some sense, that sounds like an omnibus bill. That is to say, I don't support all of this, but in general, I think people will be better off if this passes versus not passing. Usually it's used in the context of a big ball of spending that is not separated out. It's either up or down, and the real fight is what gets in it.
Yeah, that's right. So it's essentially taking, you're absolutely right, a tool that is often used to increase the size of government, which is log rolling, but do it in the opposite direction. So Cordell Hull was the Secretary of State under Franklin Delano Roosevelt.
Big ups, Cordell Hull.
Yeah, he's really an unsung hero. Was a Southern Democrat who was a passionate free trader, and he's a former member of Congress, and his insight was that the problem with trade policy at that time was that it was in the hands of Congress. And the typical congressman, was happy to was sort of a mild or moderate free trader. They were happy to get rid of tariffs and quotas, but certainly not for whatever was made in their district. And so what he suggested is, let's give the president the ability to negotiate reciprocal tariff reduction agreements with other countries, and we will accept them up or down. We're not going to second guess that. And what that allows them to do is to go back to their constituents and say, look, essentially I log rolled. I want overall free trade. I'm sorry I wasn't able to preserve the protection for what's made in our district. Sorry about that. But I really tried, and you can blame the president. So it gives them a little bit of cover. And your insight about this log rolling is exactly what's happened. Is when you package all these things together, the net benefit outweighs whatever special interest imposed cost, political cost can befall the member. So it had just to give you some quantification of how it happened. And there were other things, of course, the GATT and WTO after that were also extremely important reforms. But in 1929, the average tariff on dutiable imports was 29%. And I'm sorry, 59%. And now it's below 5%. So that's an extraordinary, increase in economic freedom that few of us appreciate.
How does that work at the state level? Is that a typical process at the state level? I realize it is with spending, but with any type of reduction in the size or scope of government?
Well, there have been a few examples. There's not a lot of examples of setting up deregulatory commissions, but there have been things kind of that have some of these characteristics. I think one of my favorite examples is, I mentioned it earlier, is not from the U.S. states, but from British Columbia. So in the early 2000s, British Columbia had acquired this reputation as just a totally overregulated state. And so there was a liberal candidate for premiership who ran on a platform of cutting red tape. And one of the first things that they did was they appointed a cabinet level minister of deregulation, whose entire responsibility was to identify which actual rules should go away. And then they set up a goal where we were going to eliminate up to 30% of rules We were going to count and quantify the rules, which we think is also an important aspect here. And they said I think one of the first 1 in, 2 out rules. If you want to have a new rule, you've got to identify 2 others to eliminate. And it was remarkably successful. Over the course of a few years, they managed to eliminate almost 40% of all their rules. And what this did was it has the same type of characteristic as a BRAC commission and as Cordell Hull's fast track trade negotiation. Is it basically allows the premier to take the credit for eliminating rules, but he pushes it off on the specific cabinet member who's and his deputies and those that he's working with to identify which actual rules are going to go. So it essentially was a log roll in that sense, where we're going to we're going to keep our eye on the big goal, which is just reducing all rules. But when it comes down to specifics, let's take some cover for that.
Matt Mitchell is a senior fellow at the Mercatus Center. We spoke earlier this week. Subscribe to the Cato Daily Podcast wherever you please and follow us on Twitter @Cato Podcast.